you all for coming back. I appreciate this. This morning we did the navigation team and really focused on our homelessness and services. This afternoon we're going to pick up other human services programs that are provided by our Human Services Department, as well as a proposal for the creation of a new Office of the Employee Ombud. We're going to finish the meeting with an opportunity for public comment at the end. Then this afternoon at 5:30, we will start our public hearing. And as I mentioned this morning, there are actually two public hearings. The first one is going to focus on the aquarium, something that we are required to do because of the amount of money that we have in a public-private partnership at the aquarium. And the second is our public hearing that is around our budget. So I'm just going to pick up where we left off and just ask, hey, welcome everybody. Good to see you, Eric. Why don't you just start introductions and we'll jump right into human services.
Good afternoon, I'm Eric Sund.
Greg Doss, Council Central Staff.
Alan Lee, Council Central Staff.
Jeff Sims, also Central Staff.
Good, well, welcome gentlemen. Thank you for being here. Okay, who's leading this one? Is that you, Alan?
Actually, it's me on this one.
All right, Jeff.
So the Human Services Department in the 2019 proposed budget receives $195 million, which is approximately an $18 million or 10% increase. The majority of that fills in one-time funding or provides increases for the navigation team and homelessness services, which were all discussed this morning. So this conversation will not be going into those. There's also new funds from the sweetened beverage tax, which we discussed yesterday, that also won't be part of our briefing at this point. There were still three items that we wanted to make sure we highlight for the council's attention, that we did not identify any issues or concerns with those three areas, but we want to highlight them. And then there are three areas that we wanted to highlight before going through council member proposals.
Hold on just a second, please.
Sure.
That's good. Thank you. We just have some problems with the lighting and their, what's that? No, it's just the bright lights that are causing the trouble.
Options, though.
Okay.
There's the ball.
Okay, well, just keep them down. This is, yeah.
This one's better.
Thank you. Okay, thank you. Now that we sort of have the ambiance right, go ahead.
Great. So first we'll go through those three areas that we just want to make sure we highlight for attention that are going on in the budget, and then we'll switch to the three areas that we've highlighted some issues. Ellen's going to cover the first, which is the CDBG, or Community Development Block Grant.
Great.
So the Community Development Block Grant, the proposed budget includes $2.9 million in new capital projects using these federal funds, and $2.9 million of this 2.7 million of this 2.9 million was found through 30 plus years of underspend in this grant program. So these funds over the years, these are for activities that were either recaptured, underspent, unallocated, and or not eligible. And so the reason why these funds were found was through the city's shift in accounting systems. The department does not anticipate that this will happen again, and they also have confirmed that they have no such couch cushion funding and other grant programs. So the proposed budget includes these four projects that I've outlined on page 2, bulleted. That includes $1 million for Evergreen Treatment Services to purchase the building in which they operate. These would be matched with other funds from the state and other sources. There's also $1 million for a land purchase on Capitol Hill for a youth and young adult affordable housing and services center. I'll also note with this ad, there's currently $500,000 that the council appropriated in 2018 in Finance General for this purpose. The city anticipates that this will be carried forward for next year for this purpose as well. So that would make a total of $1.5 million for this project.
One quick point on that. I think, Alan, we've talked about this, that $1 million and the 1.5 total for the Capitol Hill Youth and Young Adult Housing and Services Center. It's something we were working on last year. I think everybody up here is very supportive of it. There was a concern about what we could do with the CBDG money, that there were some restrictions on it. We're working with Frank Chop, also with Central College, Seattle Central College, and I think there was a request, I don't know, Ben's, yes, he is here, to see if we can do a swap. so that that money would be going into something else, so that we would have money that they could use pretty quickly for purchasing the site from the college. So I just draw that to your attention and see what we can do.
Great, Madam Chair. And actually, you flagged sort of an overall issue with these projects and moving forward, and that with these funds, there's a sense of urgency from the department on getting these funds obligated and spent. I've been told, or it's been indicated, that if any of these projects, for whatever reason, do not move forward, that the department would then execute an RFP in 2019 to bid these competitively. So continuing on with the descriptions, there's $500,000 to assist Northwest Harvest in relocating its site. And then finally, there's $433,000 for a roof replacement project for a community facility. And before we, excuse me.
Okay, Councilmember Herbal, I kept thinking you had a question here.
I didn't until he said $433,000 for a roof replacement for a community facility. I'm just interested to know what the community facility is.
As am I. So we don't have that level of detail yet, but we flagged that and we hope to receive that soon. As I said, the executive is trying to execute these with a bit of speed, and I think that they don't have those details quite firmed up yet. So before we move on from this issue, I'll also flag that we very recently found in the third quarter supplemental an indication that the executive is requesting in the third quarter supplemental $790,000, a transfer of $790,000 of CDBG authority from HSD to Office of Economic Development for a loan repayment for Alpha Sino loan, Alpha Sino. And so we need to ascertain how much of this money there is available in 2018, and if this, in addition to what's in the proposed budget, comprises everything that they found in recapturing these lost funds.
Okay, doesn't look like there's a question. Go ahead.
Okay. Actually, looking at the next area we were going to consider, we actually delved into a lot of these pieces yesterday. It was on the community-based meals and programs, and really ties in with the sweetened beverage tax, which we covered in pretty good depth yesterday, so I won't go into detail with that now.
Okay, so the third item, administrative support. So the proposed budget includes new staff positions for the Leadership and Administration Division. These include risk management unit positions, a risk manager, and a senior grants and contract specialist. So these positions would address a standing concern that the department has had regarding administration of contracts and other things that have incurred risk, and also audit findings over the last several years. So this would go to meet that administrative need. And the third administrative position is a grant writer. So this position would be tasked with diversifying and broadening the grant revenue portfolio for the department, and is expected to be self-funding after year one. So that would be something for the council to track after next year if this moves forward.
Okay, doesn't appear to be questions, so go ahead.
I'm sorry, I'm not able to hear you.
Oh, I just said there don't seem to be any questions, so please continue, Jeff.
Sure. So we're going to switch to three areas that we identified for issues that are for discussion. The first is related to contract inflation. The 2019 proposed budget provides $1.7 million for a 2% cost of living adjustment for all the contracts in the Human Services Department that receive general fund support. This would be less than the recent measure of inflation from CBO, that would be 3.3%. As you know, this has been an issue, a potential avenue for addressing the low wages earned by human services workers. There can be some challenges with other options, which is why often using a contract inflator is an avenue that could be pursued. Going in a different direction could create disparities among workers based on their funding source for a program, or could encounter other challenges. However, this approach also has its limitations in that we cannot direct individual employers on how to use the amount of resources that they receive for their contract inflation, so our ability to direct it towards wages could be limited. Nevertheless, not taking action would not have any impact then, or not resolve at least, recruitment and retention issues that have been identified previously, which can have impacts on efficiency and effectiveness, especially on services that rely on strengthened relationships over time, where you have a caseworker that's turning over frequently. We've identified a few different options, and there's also 2 council member proposals related to this. We could of course, take no action and stick with what is currently provided. The council could also look at a different amount to provide for contract inflation. My understanding is that approximately $2.8 million instead of the proposed 1.7 would provide a full cost of living adjustment. Or we could choose also not to provide a contract inflation increase in 2019 or 2020.
Any questions on this? Keep going, you're on a roll.
Okay, and there are 2 council member proposals related to this, and I thought now might be a better time to delve into those. The first one is to add $5.9 million in 2019 in ongoing funding to increase the wages of human services providers through this approach, proposed by council members Mosqueda and O'Brien.
Do either of you want to speak to it?
Sure. Thank you, Madam Chair. We know that in this proposed budget, and thank you to Director Noble for his repeated presentations. I see him sitting out there. We know that the cost of living continues to go up, and we are making some inroads in this budget to try to address the cost of living where we can for city employees and for our public servants who are on the line every day. The public servants that we're talking about here provide services to those who are currently unhoused, those at risk of losing their homes, and some of our most vulnerable populations. We appreciate that the mayor's proposed budget includes a 2% cost of living increase for those who are funded through the general fund. But the reality is, because of braided funding, many of the individuals who provide direct service to those who are unsheltered and in need of case management really need a cost of living across the board. What we are suggesting here is that we take an equitable look at how we can apply a 3.5% cost of living adjustment to all of our human service providers, recognizing that we need to bring up the cost of living to 3.5 for all of these workers. And as Councilmember O'Brien will talk about, recognizing that that's just the tip of the iceberg, a comprehensive analysis of how we can create wage parity is really important. How we can create wage stabilization is critical to make sure that we're stabilizing this population. We also know that, as you mentioned, thank you for noting this, human service providers are more likely to be women and people of color. We know that individuals who are providing the services to our most vulnerable populations, they themselves are often eligible for the housing that they are trying to qualify their clients for. We've heard stories of people living in their cars, people who are living in the shelters they're qualifying people for, and people who are relying on the food banks that Councilmember Juarez mentioned this morning. We also know that this has not only a toll on the services that individual organizations are able to provide, but the toll also comes in the form of a fiscal cost to our community partners. Annually, turnover costs on a program can range from $600,000 to $1 million, or about $5,000 per person. And one of our local human service providers noted the disparity between what they are able to pay their workers versus what our own Seattle Human Services Department is about to pay. It's about a 34% difference. I know that this council has commented before about how we want to make sure people can earn a living wage, and when a program supervisor makes just about $35,000 a year as a youth counselor, that is not an equitable wage, and nor is it sustainable. We also know that we are seeing increased not only turnover of vacancy rates, and people are reporting that they're leaving because a higher pay has influenced their ability to stay in this job. In fact, at DESC, we see an annual vacancy rate, an annual turnover rate of 38%, and 90% of those folks who left said that they left because a higher pay job was offered to them. So I have put forward to you a memo that was initially circulated at the beginning of July. And this comes from our human service providers who worked with the Human Service Department to try to come up with some way to help address the high turnover rates, the high vacancy rates, the wage disparities. And what you see in there is their edits, the line item edits that they included, really describing the need to make sure that we're getting at this pay equity issue. We have a long way to go. There's no doubt about it. And this would just be a drop in the bucket. But what it would do would be to try to put all of our human service providers on parity with earning the 3.5% cost of living adjustment that we've awarded to other city employees, and make sure that this is applied both for general fund employees and for human service providers across the board.
Chair Bagshaw, may I?
Yeah, sure. Councilmember Gonzalez.
Thank you. A few questions on not just the council member's proposal, but also on the underlying mayor's proposed budget add in this space. So I obviously agree with the assessment that Councilmember Mosqueda just laid out, and she very persuasively articulated all of the reasons why we want to make sure that through our contracts at the city, we are not contributing to or exacerbating a pay equity issue that exists across the board for a particular profession. And so I think it's wise to try to figure out how we can grapple with the realities of the severely underpaid realities of this particular sector. But I have a couple of questions. One is, my understanding from the proposed budget is that this is only for 2019, and that seems to be the same for the council member proposals. Or is it for both 2019 and 2020?
The 2019 proposed budget from the mayor has a further increase in 2020. So you'd have 1.7 million in 2019, and then, sorry, I can't locate the number on my sheet of paper here. I think it's 3.6 million total in 2020. So you'd have your initial increase in 19, and it'd go up a little bit higher for a total of 2%.
But it's still at the rate of 2%. It's just compounds in 2020. Is that accurate?
That's correct, yes.
Okay. And then this proposal only talks about 2019. Is that accurate, or is that an error?
The proposal from Councilmember Mosqueda, that's correct.
It's only for 2019.
Is my understanding.
Yes, thank you, Vice Chair.
I'm a chair of something, but not this.
We did include the 2019 number. We do have the 2020 number. It's on the whiteboard in my office. I'm sorry, I was looking for the numbers as well. We can get that information, but basically it would be the difference between the 2% increase to the 3.5% increase for the next year as well. I will grab that number as we talk.
So aside from just the clarity around the numbers, are there, and without divulging any potential attorney-client privilege communications or legal concerns, are there any issues related to the proposal from either the mayor or council members to effectively in the midstream of the execution of these contracts, suddenly changing this component of the contracts that we RFP'd in this space?
There was certainly, I did highlight some initially. The first I would point to in the mayor's proposal is this is a contract inflation overall. So there are a variety of costs that would go that a nonprofit faces, rents going up, fuel costs go up, things like that. So providing overall contract inflation will not necessarily steer all of the funds that we're providing to provider wages, and we would have limited control to make sure that that would happen. In addition, you could have a situation where if the city were if the contract inflation did result in increasing wages, you could have a situation where a worker who is funded through the city contract could face being paid a different amount than some other contract that has not also been increased. And then we have limitations on, just broadly, on our ability to provide funds without receiving consideration as a city, which means receiving some change in services that we're receiving or something along those lines. So that if we broadly just supplements a contract, not related to these proposals here, with a lot of new funds, we also need to be getting something back for those funds that we're putting into it. Otherwise, it would be a gift of public funds, which would not be permissible.
And if the committee wants to have a further discussion here, we can arrange for perhaps another opportunity with law department.
I think we're all interested in trying to figure out how to problem solve in this particular space, and at least personally, I think I would benefit from having an executive session in which we can hear from our city attorney's office about any potential complexities here, and then I think that will help us as a city council make a decision, hopefully in collaboration with the mayor's office, around how we move what I think is a shared priority and interest forward, but in a way that minimizes risk. And maybe the mayor's office has already undergone that evaluation, and I just don't have the benefit of having seen it quite yet. But I think we could all benefit from that type of a briefing from law.
Good. Thank you for that. Council President Harrell.
Just a question on the proposal, just so I make sure I'm understanding it correctly. The 5.9 million that would increase in human services providers, that's in addition to the 1.7 that the mayor has proposed, not as a replacement. So it's 5.9 plus the 1.7 for 2019?
That's correct.
Okay. And then that's sort of spread out among the 200 plus community providers to address the wage concern. It's spread out. How is it applied to the providers?
Sure. There's essentially two actions going on. Councilmember Mosqueda, would you prefer to explain it? Or? So first, the mayor's budget is proposing a 2% contract inflation amount. What is being proposed in the 5.9 billion would raise that to 3.5%, and it would also go more broadly. So rather than just being grantees that receive general fund support, it would extend to grantees that receive other contracts where the city may be a pass-through as well. So it's a broader base and also a higher amount.
So I'm simply asking, it's sort of spread out evenly amongst the providers. It's like a peanut butter approach. You spread it out of the providers that are receiving money from us.
Yes, at least the mayor's proposal would be a across-the-board 2% increase. There wouldn't be variation per contract.
And I don't think there's any argument about these folks are doing great work and they're underpaid. That's not my concern at all. In fact, I have a lot of friends that remind me of that when we go out. The question I have is, how do we then assure that the actual money is going to wages? Do the providers actually give us a breakdown on when they receive funds on how much goes to wages and what the categories are, and then we can see that it like on a pro rata basis, it's going up to wages? What kind of safeguards do we have in place to make sure it's getting to exactly the recipients we want it to go to?
In the approach where you are providing just an inflationary increase, reflecting that across the board a variety of things are more expensive for a provider to be able to do those services, we don't have the ability to direct that they would go to wages. There would be ongoing reporting, as is the case with any of our contracts, that we would be aware of how costs are being spent and monitored.
And I know there's the next piece of legislation sort of addresses the analysis of this issue thoroughly, so I don't want to jump the gun, because that's sort of, I think, what we're hinting around to a little bit, is better understanding the mechanism. But I agree with Councilmember Mosqueda and O'Brien that ideally we would like to just to address the issue, and I think Councilmember Gonzalez is saying we want to make sure we're doing it the right way. So, thank you.
Any other comments on this?
Just one more.
Mosqueda.
Thank you, Council President Harrell, for asking about how the dollars would be distributed. And the two components that central staff is speaking to, I think, are critical for when we discuss parity. We heard from many of the human service providers the deep desire to make sure that they are raising the wages. The concern that came from some of our human service provider organizations that don't solely rely on Seattle General Fund is that if we just provided a parity in terms of a COLA for just those who receive general fund, then they were not going to be able to make up that difference for some of the other positions that rely on county or state funds, for example. So when I mentioned braided funds, the importance of making sure that we're bringing a COLA up to 3.5% for all of these types of workers help us help the human service providers equally apply that COLA increase across the board instead of having differences in wage scales depending on where the fund comes from. Again, I understand that this is a complex issue that this council has tried to address in the past, and even one that we tried to address in part in our earlier discussions this spring. So part of the analysis that Councilmember O'Brien is championing that I fully support as well helps us get at a better analysis of what we actually need to do to bring these dollar amounts up. The reason I think, though, that it's important for us to, A, apply a COLA for these workers is because their COLA is not on par with what other city employees we know that they need in order to meet the cost of living increases. So yes, I think we need to bring it up to 3.5, but I also think it's important that we bring it up to 3.5 and apply it across the board so that our human service provider organizations aren't in the impossible decision of explaining why one position received a COLA and one did not. And so that's why you see the request to apply a 3.5 across the board.
Thank you. Councilmember Gonzalez.
Thank you. For central staff, are you, my understanding is that other municipal funders in this area do actually provide a COLA portion of the service contract. Is that accurate?
When you said
In other words, does King County provide this type of, do they have this type of model?
I believe that's correct. I couldn't speak to every contract. There are also, given the range of the different contracts, there are certainly some that do provide that.
And do we know what the percentage is for the King County contracts?
No, I'm sorry. I could get back to you on that.
I think it would be helpful to, in terms of this parity issue that we're talking about up here, it would be helpful to get an understanding of how we compare to folks in the regional system of providing funding in this space and sort of how they address the realities of COLAs and the need to make sure that we're not contributing to a suppression of the market in terms of wages for people we're asking to do this hard work.
Okay.
Please proceed. I think questions have been answered.
Second proposal related to this this area, it's sponsored by Council Members O'Brien and Mosqueda, adding $150,000 in 2019 to conduct an analysis of human services wages.
Okay. Councilmember O'Brien, do you want to take this one?
I will. I mean, I think a lot of what we've talked about applies to this too, and Council President Harrell referenced this too. I'll just reiterate a little briefly that we expect so much out of the folks working in these services on one of the most complex issues facing our society right now. And we have to figure out how to make sure that the individuals doing this work are compensated fairly and that the agencies have the resources to retain and hire the best skilled workers to do this critically important work. So in addition to the previous item that Councilmember Mosqueda talked about, this is following up on some of the ongoing conversations that have been having. The Human Service Department has been a great partner in hosting those conversations about how we address this. And it's complex, as we know, but I believe this investment in the wages will help us kind of chart out a path to getting something that's a little more sustainable going forward.
Okay. Let's go to the next one, please.
The next program we have up is LEAD, the Law Enforcement Assisted Diversion, and the LEAD program is seeking to expand its coverage in two ways. The first is in precinct geographic-based coverage, and this would be done by adding $462,000 to allow the program to expand into the Southwest Precinct and into the South Precinct. These are two precincts that have not received services, and as you can see in the table there, each one would have an outreach coordinator, a case manager, and then a project manager split between the two. Then the program would also expand by deepening coverage, adding capacity at each precinct. The program has said that a bottleneck right now is around a lack of case management facility. And so once all the precincts were receiving lead services, 5 additional case managers would be distributed on a per precinct basis to allow for additional case management and deepened coverage. There were some questions about the SLI and about the proviso with LEAD. And I would let you know that the executive has not transmitted the SLI. A lot of the information that was requested in the SLI was about LEAD going to sale and improving its geographic coverage. So by virtue of having this proposal before you, the program has answered those questions. There are some other questions that were asked in the SLI relative to recommendations for evaluating the effectiveness of the program and around demographics. And the LEAD program has indicated that they're working, they have a committee working on the evaluation criteria, and so that's something that certainly the council will hear about later.
Councilmember Herbold.
Thank you. I want to thank Councilmember O'Brien for bringing this forward. I am eager to understand more about the outcome of the SLI response. And just as a point of clarification for me, is the SLI response focused on how operationally focusing on an RV resident demographic has resulted in sort of a different model? Does it deal with the issue of the effectiveness of the RV model as opposed to their other model of focusing on street disorder?
Well, the SLI itself doesn't deal with issues around RVs. It's the proviso that deals with issues including parking infractions and other traffic violations related to vehicular living. But I hear Alan telling me that you were, go ahead.
Oh, yeah. Yeah, I mean, Greg is correct. The SLI itself does not explicitly indicate the RV service provision that was incorporated into the model this year. I believe the language, though, is open so that it could include it because I believe it talks about operations in general, but it does not explicitly call that out.
All right. I mean, I would just, in general, it's a new approach, and I know it's only been operating for a short period of time. I think it would be interesting and useful to us to learn more about it. And I have communicated with folks at LEAD, and they have let me know that the North Precinct's LEAD is one of a few programs that are outreaching and collaborating with SPD's parking enforcement officers, patrol, and community police teams simultaneously, and that there's a lot of cross collaboration of service providers. So, you know, I've often advocated for expanding LEAD to Southwest, particularly in light of the interest on the behalf of the county to have a LEAD program in White Center. And White Center is the Roxbury line is right on the border with the South Delridge and Highland Park neighborhoods, and those are two neighborhoods that have been advocating for LEAD expansion for some time. And we have learned that the county has proposed addition of funds for expansion into White Center this year. So I think it makes the expansion of LEAD into the Southwest Precinct all the more important so that we don't have a situation of one thing happening on one side of the county line and the other, and something different happening on the other. I think it's really important to fulfill the interest of the community to expand it, but also I think it makes a lot of good operational sense.
Great, thank you for that. Councilmember Wards and Councilmember O'Brien.
Thank you. I did have an opportunity, and I see they're here today, to meet with Tracy Gillespie and Tara Moss and Katrina Johnson regarding LEAD in Aurora and the expansion or the need. I know that we invested $750,000 last year, which was money well spent, but going to table 2 and using for the $538,000 in added capacity or deepened coverage of the $538,000. I'm not sure how is that broken down into where that's going to get, that money is going to add capacity and deepen coverage. I mean, it's kind of like you've broken it down for South and Southwest precincts, but the remaining balance, 538,000. I don't understand where that's going.
So the 538,000 is made up of two components, the 400,000 for the 5 case managers that would be distributed around the precincts. And I apologize, I didn't address the 138,000. That difference is flexible funds that could be used for diversions, reuniting with family, or first and last on an apartment, immediate sort of client-centered focused interventions that could get people housed.
So if I'm being asked to support this $1 million, and I thank you, Councilmember Herbold, for what you shared about West Seattle. So that still doesn't answer to me if the reason why I'm being told that we need to expand LEAD $1 million or 462 for the South-Southwest, but 538 for other places and 5 case managers. That doesn't tell me where, we don't know where those 5 case managers are being placed. Is that correct?
I don't know the exact geographical distribution. I know that they're intending to deepen in each precinct, but within the precincts, I don't know.
Okay, well, my concern is that my understanding, it was made clear to me that additional funding is needed to accommodate the demand on Aurora, which is taking up about 80% of the north end funding. And as you know, we have one precinct that covers 3 districts, which is well over 300,000 people. That's just who live there. That's not counting who works there, who goes to school there, who shops there, and also who has issues there. So I'm not inclined to be supportive completely. I'm not completely there yet, unless you can come back to me and maybe share with me, again, sharing with what Councilmember Gonzalez shared and discussed this morning, geographical parity, not for geographical parity's sake, but to justify if you're asking for my support, and you're asking for, and you're telling me there's going to be 5 case managers and 138,000 in client direct services, I don't know where that's going to. And that's the concern, and that's the question that I would ask that we could maybe drill down a little bit more on, because you hear different things from different people, and so I would just like some clarification on that matter.
I will. And another thing I should add is that the deepen coverage, the program staff have indicated that that's not what would be necessary to bring the program to scale entirely. That was one of the questions of the SLI, was what would it take to bring to scale entirely. This wouldn't get there, but I was told that it was a good next step to deepen coverage.
Right, and I'm very supportive of adding capacity and deepening coverage based on the success of the LEAD program. But I guess what it has kind of gotten away with us, or not with us, but some of us, or some of the issues, is that I really want to see LEAD being used for what it's actually supposed to be used for, law enforcement assisted diversion. That's its focus. That's so again, that's just getting back again to why I want to be able to say yes to this an additional $538,000. I don't have my glasses on. Yeah, 538. Thank you.
Councilmember O'Brien.
Yeah, thank you. I want to touch on a couple things that have come up. First, Councilmember Herbold, you asked some good questions about how it interacts with, or how LEAD is interacting with folks living in vehicles. And my understanding, consistent with what folks said, is I believe the work with vehicles is so new, I don't expect that will necessarily be covered in the slide, but I do think that if we want to get some specific information, just reaching out directly to the folks in LEAD as you did, and as we gather information, maybe we can just share that. My understanding is that there's been some pretty good progress on that, and that population seems to be a good fit for the program too. So I think I want to also touch on a point that I can't remember who it was Gregor Allen just made, but that about taking this to scale. If we're able to fund this ad, this will put LEAD in all. They will have a presence in all precincts but I want to be clear that that's a difference, a distinction between that and being citywide. To actually cover the demand for these services citywide will require a few more years of increased investment. And I want to talk just about what I think Councilmember Juarez was alluding to a little bit in the north end. My understanding is the LEAD folks, as they've rolled out in the last few months to the North Precinct, have focused on 3 geographies. The first one being, Aurora and 95th area, but also in Ballard and the University District, 2 other areas where there's, a series of challenges where the program has a good fit. And what I've heard is that they're already nearly at capacity for the caseload that they can handle. It didn't take long. And I think a lot of us aren't surprised by that. And those are just 3 really distinct, discrete geographies. There's obviously a lot of other communities in the North End that may be interested in this. And so my hope with this ad was to allow all the precincts to be able to have access to this. Councilmember Herbold, your description of how a coordinated effort between the city and unincorporated King County is a great example. And at the same time, I also know there's more demand in the North End we want to add to that. I do want to provide some flexibility so that as our law enforcement professionals and our community members and LEAD professionals assess what is happening throughout the community, can direct some of the resources to the place where there's the greatest need or the greatest, maybe even the greatest opportunity to make improvements. And I'm also agree that I know that people in the district I represent have a lot of concerns and want to see some of that investment coming there. So I'm curious to hear how specific this is, but I also think that some flexibility is important to allow the program to adapt as situations adapt on the ground.
Good. Councilmember Johnson.
Just briefly, I want to say I think that the expansion is important to me, I think, for 3 reasons. One, if you're a LEAD client, you know no geographic boundary. And so we should make you eligible whether we're making contact with you in the South Precinct, the Southwest Precinct, the East Precinct, the North Precinct, or downtown. Secondly, I'm not usually the person who's making the RSJI argument here at the council, but the fact that the South and Southwest precincts are 2 of the last precincts that we would expand to reeks to me of an opportunity here for us to right some RSJI wrongs. And the third is I think that having a person-centered approach here, like we've done with LEAD, is very consistent with the expansion of what we've seen with the Community Service Officers program. I just hear time and time again from folks in community that they want us to see, they want the city to be taking a person-centered approach, not incarcerating people, but working with them to get access to treatment. And I think that this is one of the best ways we can do it.
Council President Harrell.
I just want to make the point that while I'm excited about the possibilities of expanding LEAD to the Southwest and South Precinct, Southwest, I say it first, Southwest and South Precinct, which makes sense. We've been investing more and more money as years go by into the LEAD program because of its success. Perhaps there's some way during this budget cycle we could, with statistics, show what the success looks like, who we're diverting, how it's working, why we continue to invest in this. In this particular write-up, there's really nothing about that other than we've expanded to the East Precinct and the North Precinct, but the success stories aren't told, and so that may help us through the budget process.
Thank you. Did you want to add something?
I have nothing more to add. Councilmember Johnson ably made my points, so thank you.
Okay. Very good. Councilmember Mosqueda.
Thank you. Earlier today, I mentioned that there's 5 new charges that LEAD has expanded their services to so that we are getting more individuals into the LEAD program and diverting them away from the justice system or incarceration. And just so that we're all aware, it's misdemeanor theft, misdemeanor property destruction, obstructing an officer, criminal trespass, and unlawful bus conduct. With those new charges added to the LEAD's list of activities that they engage their potential clients on, I think it's no wonder that many of our LEAD community organizations and officers are at capacity. We are literally saving lives by helping to divert people away from the criminal justice system, and hopefully we are also getting people connected to those services that they need. When you think about an individual who might be obstructing an officer or unlawful bus conduct, it's probably people who need case management, people who need housing. And so I do agree with the statement that was made that this is not a replacement for an actual citywide outreach effort, but I'd be interested in looking at how we can enhance the dollars here so that we can reach more folks in the north and south end.
Okay, great. It sounds like we've got a good direction there. Do you want to proceed?
That's all I had.
Okay, well, I have one more thing to add in LEAD, and it's different from what we've talked about for the last 15 minutes, and that is part of the records management system in our police department. A new program is called Mark 43, which is coming online after the first of the year. Concerns have been raised that what the officers on the ground can input into 43 and what kind of queryable information they can get is not clear at this juncture. I don't think this is going to be a budget item for now, but I want to flag it because I'm sure that in our first quarter supplemental that we're going to need to be able to help find out what new information is going to be needed. But I understand that even though the LEAD program leads would like to have that information on the ground, it's not available at this point, but it definitely needs to be coordinated. And when I met with police and with our LEAD leaders this week, they explained that Ride Along is going out of business. Familiar Faces, the work that they're doing in King County, we'll also be using with Mark III, but ultimately we need to have this reported information available to officers when they're on the ground to identify an individual, whether or not they're participating in LEAD. So as the interface is being developed early next year for this program, I just want to make sure we're highlighting it and that we put ultimately some money in the budget for next year that will allow us to make those external and internal links.
Thank you, Councilmember. I might also point out that there's some discussions with Seattle IT and with LEAD about some work that might be done to help LEAD scope out a database on their end that would make sure that it could communicate with the RMS, with the police department, and with other providers. And that work may involve some consultant dollars from Seattle IT to make sure that the product that they get up and running is one that could communicate with the RMS eventually in the vision that you mentioned. The program staff also talk about the importance of having that kind of database to be able to call up the data and when it comes to measuring outcomes and measuring performance. So that's another step there. That's another thing they're thinking about now.
Great. Thank you. All right. Anything else in this section? All right. So that brings us to our
Community
council
health
member proposals.
Oh, actually, no, we have one further issue to identify.
Okay.
And that is the community health engagement location. Well, first of all, a community health engagement location is a program in which people can engage in the supervised use of narcotics and also access key mental health or social services, medical care, needle exchange, other services that can help them in their treatment. So the council this year appropriated $1.3 million to Finance General to be held in reserve for the opening and operation of HL. This year, in several committee hearings and Councilmember Mosqueda's committee, the council has received various updates on the city's progress towards opening HL. So some of the things that the executive, some of the things that were done by the executive this year. So they moved a strategic advisor position temporarily from the Human Services Department, the Public Health policy advisor to the mayor's office to lead this effort, as well as the city's overall efforts in addressing the opioid crisis. They also undertook an assessment of city-owned properties to determine whether any city-owned properties within the city are appropriate for the opening of a CHEL. The answer to that was no. They also confirmed with King County as to whether any King County owned sites within the city are available for the opening of the CHEL, and the answer there was also no. So one of the reasons why the city has indicated, the executive has indicated that opening a CHEL in either leasing or acquiring property is unlikely is because of the expense. And so for this reason, they have pivoted to a so-called fixed mobile site. And in this model, a modified medical van would be parked next to a partnering agency or some entity where the supervised consumption would occur in the van, and the other services would be located with the partnering site. No such partner as of yet has been identified. So the 1.3 million that was appropriated in 2018 is, of course, still in Finance General. And in the proposed budget, that 1.3 million is expected to carry forward for the same purpose. So what I have in Table 3 on page 6 of the staff memo is a range of estimated costs for a mobile fixed site CHEL. And they range from operating models that differ in both hour as well as staffing. When I say staffing, I also mean the type of services available at the CHEL. They range from a 40-hour model that does not include primary medical care or medication-assisted treatment, up to the city's preferred model, which is the 70-hour model. The 70-hour model would be open 7 days a week, 10 hours a day, and would offer a so-called full service CHEL with all of the amenities, including medical care, primary medical care, medication assisted treatment, social work, case management, and behavioral counseling. The city prefers this option because this is an untested model, and they want to have sufficient operating time to determine whether the model is successful. And also, the more important reason is that people who are suffering from opioid use disorder or similar addictions do not follow a 5-day-a-week, 40-hour schedule. I'll also note that King County has offered funding for this effort. This year, $570,000 was available for through the mental illness drug dependency tax, and the county has indicated that it would not spend this money this year, and that it could be made available next year. In addition to that $570,000 in one-time funds, there's also an ongoing $440,000 available for this effort, ongoing from 2019, pending approval of the county budget.
Any questions on that? Okay, please continue.
So I do have some options here where, because the city is not likely to stand up a CHEL in the first quarter of 2019, the council could appropriate up to 9 months of operations, and also or the full capital costs to augment the 1.3 million that is anticipated to be carried forward. So there are two councilmember proposals related to CHELs. So number one, add 440,000 in 2019. This is from Councilmember Johnson and would be used for one-time expenses.
Councilmember Johnson.
Thanks. Alan, I chuckled at your understatement. that folks who are struggling with addiction aren't doing it within the course of a 40-hour work week. And I chuckled because it was a wonderful turn of phrase, but it's a wonderful turn of phrase around a really terrible thing that is happening in our city and throughout the United States when we think about opioid addiction. So I've asked for us to contemplate bringing forward this $440,000 ad so that we can fully fund the capital expenditures associated with the setup of the safe consumption site, AKA CHAL, that has been proposed. I believe that there continue to be good conversations going on between the city and the county about the operating costs associated with it. In my continued conversations with the county, if we were to make this $440,000 ad and put our total at $1.7 million, they believe they've got 1.3 according to your math, Alan. That 440 that you talked about plus the 575 plus maybe a little bit more that could come in some additional mid dollars or some other places, that should give us enough to both operate and open CHAL for the minimum 2019, if not beyond. So I'm asking for my colleagues' support for this additional $440,000, and may come back around and ask for some flexibility about how those dollars could be spent. Right now, as Alan outlined very well, we have asked for those dollars to be used for one-time setup costs, i.e. capital costs, but on the off chance that site development comes in a little lower than expected, which is the majority of those costs, we may want to have the flexibility to allow for those dollars to fund operating expenses of the safe consumption site as well. We, I think, have made a statement time and again as a council about our support for this, but I just want to remind people that safe consumption sites have been saving lives all around the world for more than 30 years. And I'm a big believer that a place where people can go to get access to services is a harm reduction model that we should continue to pioneer here in the city of Seattle, and hope that as we get further along in the budget process, I'll be able to count on my colleagues' support for this.
Okay. Council President Harrell.
Just a question. Thanks for bringing this forward, Councilmember Johnson. Looks very intriguing here. I just had a clarifying question. So table 3 are just estimates. That's not in the base budget. That's just an estimates of what this can look like. And so Councilmember Johnson's proposal of the 440, it's a little more than the vehicle acquisition cost of 350. So that assumes some staffing costs in that as well, I assume, right? Because it says there vehicle acquisition 350. This is so.
My concept, Council President, of the 440 ask gets us to the total one-time cost of 1,740. So right now we've identified $1.3 million from last year that will carry over into 2019.
I see.
So the 440 encapsulates the delta difference from what the mayor's office has proposed of 350 plus 90 in community outreach. So it gets us to the full capital cost of 1.74.
Got it. Okay, thank you.
Did I do okay, Alan?
That was great, Councilmember.
Thank you.
Madam Chair.
Please.
If I might, Madam Chair, I just want to underscore my support for this, and I really appreciate Councilmember Johnson's continued leadership on this. In fact, this entire council has said time and time again that it wants to see overdose prevention sites be enacted in Seattle. I also applaud the mayor for including the $1.3 million in her underlying budget that she proposed to us, and for the county's partnership with us to make sure that we are moving forward and advancing best practice public health models. And this is a harm reduction model, as Councilmember Johnson said, that has been proven time and time again. We also know that it's important for us to do this for the public health and safety of our employees. Earlier today, the chair mentioned individuals who are on the front line, whether they're working in parks or in our libraries, who are getting stuck by needles. We need to have a place where individuals have the ability to have overdose prevention services readily available to them, and that consumption is not happening like it's currently happening on our streets and in our parks. And when they come inside, it is critical for us to be able to connect them with services so that people can get the treatment that they need. I want to underscore that last point. This is not being done in isolation. I'm happy to be joining this council as you're considering this budget this year. I look forward to working with you to make sure that this is a component that we augment in this year's budget, because when we don't have overdose prevention sites. Individuals are still consuming outside and overdosing. They're dying, and they're also putting the other community at risk with leaving needles outside. So it is important for us to have this component in partnership with King County and their efforts to do education, overdose awareness, getting folks into treatment, and making sure that we're coupling this site with, as Alan mentioned, a brick and mortar location that can make sure that there's a waiting area and counseling services. So I think our commitment to this continues. I hope the community sees the commitment that this council is putting forward in combination with the mayor, and applaud her leadership on this as well for advancing it. And really just want to say, as Councilmember Johnson mentioned, you know, these sites have been proven effective in other areas for 30 years. You know what else was proven effective 30 years ago? Needle exchanges. And we led right here in this corner of the world with needle exchange sites. And now it is a best practice proven strategy that other public health entities have repeated time and time again. Let's go forward. This is a proven model. I think we can do it again here in Seattle.
Thank you for that.
So the second proposal, number 2, is a statement of legislative intent requesting the Office of the Mayor to identify a site for HL. This is Councilmember Swan.
Thank you. Just to add to what the points that Alan already made, this is something that's been demanded by community members for years. But I just wanted to highlight that even at the last budget hearing that we had for this year's budget deliberations, there were several residents from Capitol Hill who specifically said that this is a need that has not been fulfilled for Capitol Hill as in specifically, but also D3, District 3 as a whole. And given how the opioid crisis is hitting our city, and we see these disproportionate effects in some areas of the city, I think it is important that this statement of legislative intent reiterate the need for identifying a specific site as soon as possible.
And with that, I think we will move on to the other budget actions proposed by council members as of October 10th, 2018. And this is starting on page 8 of the memo with substance use disorder. Number 1, add $762,000 in 2019 and $762,000 in 2020 for substance use disorder treatment. This is Councilmember O'Brien.
I'll just say what I think everyone here knows is that with the crisis that's going on nationally and locally around opiate epidemic, we see a significant number of people trying to access treatment, and often one of the constraints is that there's a lack of services to be provided. This, I think, is critically important and as part of a suite of things we fund as we try to address the crisis folks are feeling on the street.
One moment, please.
Yes.
How many locations are available? Looks like 15, right? Councilmember O'Brien, I certainly support this effort for treatment on demand. And I was just asking Allison, because we looked this up last week about the number of locations around our city that are already available and accessible to individuals so that they could access buprenorphine and others. And it was far more than I thought. And I think you and I shared some information around Harborview Hospital. There was an article that had been written about a hospital in Oakland and what it was doing. We found out that here in Seattle, we were doing way more than what the Oakland article was focused on. And I can't remember the number, but it is impressive. That's what's already available. And I would like to, first of all, acknowledge those hospitals and medical facilities that are opening themselves up and providing buprenorphine for their patients, and then finding out where are the gaps. So where are the gaps that we're trying to fill if we're looking at treatment on demand and making sure that, again, geographically across our city, it's available. And
I can speak a little bit to some of the specifics of where this number came from, but also address that my intent would be to this money to be available broadly to meet the need. This was in conversation with Evergreen Treatment Services. They operate a treatment facility in Soto. I don't remember the specific hours of it, but I think it's open relatively early in the morning, and I think it shuts down about 1 p.m. And the addition here would allow it to stay open later into the afternoon, 6 days a week. They serve hundreds of folks there on a regular basis and have the capacity to serve more if they could just extend the hours. They also operate, I believe, the only mobile van that's licensed by the federal government for treatment in the state of Washington.
Oh, I beg your pardon. I didn't realize that this was focused on the mobile medical vans.
No, this is not.
Okay.
But I want to just highlight that as another possibility. I believe the mobile medical vans are slightly different than the vans that can actually offer treatment, including methadone or buprenorphine. How do you say it? Bupe. Thanks. My understanding is that the federal government has been unwilling to license a second van in the state of Washington. The van they had was somewhat run down, and they got additional funding, so they're allowed to replace the one existing van but not expand the service. But they told me if we could get the federal government to license more, we would be ready to go to serve more sites on a rotating basis. Again, it's not rotating randomly, but it would be a certain site at a certain time of day, and later in the day they could be at a different site. I also heard some of the challenges are around how the nurses are licensed to offer the treatment. I'm not an expert on this, but there are apparently two classification of nurses that have very similar sets of skills, but by state law, this type of treatment requires one set of nurses. There's very few of, and if the state were willing to expand the definition, they would have a much easier time hiring. So those are two challenges they faced in delivering the services they want about the nurse categorization and the mobile licensing. But another one they said was simply the manpower to keep the doors open longer in the day. And so this dollar amount was derived specifically to address that concern. But at the same time, my intent would be to provide a chunk of money and allow the folks to come up with a program or an RFP to figure out where the greatest need is and how we could best meet that need. And if it's extending the hours in SOTO, great. If it's through some other another organization or another location, I am totally open to that. I just want to make sure that the moments that someone is ready for treatment, that we have a place for them to refer them.
Thank you. Please continue, unless anybody's got a question.
Going into the behavioral health area, item number 2, add $403,030 in 2019 and $403,030 in 2020 for a single diversion portal program. And this is Councilmember Bagshaw.
Thank you. Last week, I distributed this to all of you, but I'm just going to do it again because it's such a great graphic that Joseph Piha did for us. And one of the issues that I am most interested in is coordinating our response. And as I talked last week about having a low acuity fund for our first responders, so that our first responders aren't having to send out ladder trucks when someone calls and says that there's somebody down on a sidewalk and that they need help. So that gives them an option. I'm looking into this with Chief Scoggins and with a large number of folks who have been considering what options are available. And as I mentioned last week, we know that Mesa, Arizona, and Colorado Springs, just as examples, and our own Kent Valley Fire Department have something similar to this. But the single portal, and many of you already know this from Allie Franklin, who is at Crisis Connections up at Northgate, that she has asked that we provide additional FTEs for her, because if we can have 24/7 staffing available to help us respond and then coordinate when calls come in, it can really lessen the load on our firefighters and first responders and also improve the response for people who have these significant issues. So since the mayor has asked for some time to coordinate all this, that I'm going to be asking and identifying that we put money into, essentially into a holding spot for this as we're going forward in 2019. But I'm also going to ask for a very short period of time. By the end of first quarter, I want to have a very person-centered, less expensive, more effective design on how we are responding to individuals who make these calls. So I will come back to you with details, but right now details are not available. But I am going to move forward with this recommendation and green sheet.
The next area is youth programs and also the Seattle Youth Violence Prevention Initiative. There's 4 proposals related to these. The first is add $385,000 in 2019 to coordinate and implement a multi-strategy cross-sector youth violence prevention services program. This was proposed by Council President Harrell.
Council President Harrell.
So I'll describe all 4 of these because they're all sort of youth-related and youth violence prevention related. Now, correct me if I'm wrong, but these aren't so much ads, are they, as so much as they are existing investments we're making that I thought, and I could be wrong, my staff could correct me, I thought that many of these organizations, particularly on the South End, but that are really doing, I think, some outstanding work for the Safe Passage Program, as an example, the Youth Violence Prevention Contractors, the Boys and Girls Club, et cetera, that are doing some really great work. And as I understood it, a lot of these organizations may, if an RFQ is issued, may actually compete against themselves for some of these services. And the thought here was to make sure that they weren't actually doing that and that the funding was still much intact. But so I didn't see so much as ads when we put this together as assurance that there was going to be a continuation of some of this, I think, very unique and groundbreaking work that they are doing. But I'm going to ask you, because my staff worked on this with me, are these ads or are these continuations of monies that were in the budget? I thought all 4 of them were not true ads.
You are correct that these are all amounts that are close to or exactly the amount that's currently received by these grantees for the particular model. Most of these are related to the Seattle Youth Violence Prevention Initiative. Initially, the RFQ to the first open funding announcement for all of these programs was intended to be introduced a little bit earlier than it has been, and so these agencies could have faced not having funding in 2019. There's the process. It's a co-design process that the executive is engaging in, and they're actually continuing that process, which my understanding is that the RFQ is going to be delayed well into 2019. Right. And the plan at this point is not to discontinue funding for any of these organizations or make them compete to retain their funding, but instead they will be offered the chance to continue providing services through 2019, and that applicants that are successful once the RFQ is released next year will receive funding beginning on January 1st of 2020. And actually with, I believe, one of these, it is actually the funding announcement that it would relate to won't even be released in 2019. The design process for that is likely to extend all the way to 2020, so we could be looking at 2021 before they'd have their funding in jeopardy.
So I just wanted my colleagues to understand, while we sort of had a placeholder in there to describe them as ads, what I'm trying to effectuate during the budget process is an identification of these programs, at least in my opinion, are working, and they're working well, and that there's a lot of lives being saved and a lot of lives being changed because of this great work, and we're trying to make sure we're establishing some kind of continuity without sort of pushing back on this notion that we know that HSD are really trying to become more outcome-based, and we're asking them to do some measurements and re-examine the old way of doing things. But it's been my opinion that a lot of these organizations are really unique and doing some great work on the ground, and I want to make sure that we didn't sort of miss a beat. So that's why these placeholders are on there. They're listed as ads, but they're not true ads in terms of budgetary impacts. Okay.
Thank you. Any questions on these?
The next section is related to senior services. The first ad is for $249,000 in 2019 and in 2020 for an LGBTQ senior center. There's a few different proposals for this from council members Herbold, Gonzalez, and Sawant.
Councilmember Herbold, do you want to take this one?
I do, thank you. As relates to the LGBTQ senior services item, the funding would allow for an LGBTQ community-based seniors nonprofit organization or organizations to reach at-risk and underserved populations of LGBTQ elders by delivering nutrition and food services, health promotion and fitness, educational and social support, social and housing services, enrollment, and housing assistance, as well as case management. The goal is to address the growing aging and health challenges of socially isolated LGBTQ older adults and to provide innovative programming for all LGBTQ generations and all seniors to strengthen the community and allied responses, building on the strengths and history of LGBTQ elders. Seattle has one of the largest LGBTQ populations in the country, representing more than 8% of older adults, and the number is growing rapidly. LGBTQ seniors remain largely invisible in services and housing, and because of the extremely high rates of social isolation among LGBTQ older adults, aging in community and being connected, engaged, and safe is critical. Without these specialized services and targeted outreach for LGBTQ seniors, there are severe consequences for LGBTQ older adults, their families, and communities. It's critical that these services originate in the LGBTQ community so it is trusted and equipped to reach the most hidden, underserved populations. And the funding would also support money for an LGBTQ community-based provider to make sure training and other housing services are and access to other housing services to support the delivery of LGBTQ affirming services is possible. The money, as proposed, would be RFP'd and would invite LGBTQ organizations to work together on a joint application if that's something that folks were interested in doing.
Great. Thank you. Councilmember Swamp.
Thank you, Chair Bagshaw. And thank you, Councilmember Herbold, for summarizing it.
Oh, that's fine.
Sorry, I'm not.
Some of my best friends call me
fully
Herbold.
well today. In the 2015 budget deliberations, my office had, on behalf of the People's Budget Movement, put forward a statement of legislative intent asking the Parks Department to develop an LGBTQ community center. Unfortunately, the majority of the council had voted against it, but I'm glad that this question is coming back. I mean, obviously, this is specifically about senior needs, but I think the senior needs are encapsulated on the larger needs of the LGBTQ community, which have been quite underrepresented in the mayor's budget. As Debbie Carlson from LGBTQ Allyship said at the public hearing, there's hardly any mention of LGBTQ community in the proposed budget, and I think that that's a scary oversight, and I think we should highlight that and situate this question of senior needs in the larger needs that are not being funded. And I will also say that this is absolutely critical in light of what is happening under the Trump administration. We've just seen the completely unacceptable and also for the trans community terrifying proposal that has come from the Trump administration. And I just wanted to highlight one thing that has been reflected in the article that was just published in the Atlantic, in which they say that since some advances were made now under the Trump administration, protections for transgender patients have been eroded. After a court hearing, the Trump administration has already said that it might not investigate healthcare discrimination claims involving transgender people. Now the administration is urging the government agencies to define quote, sex as either male or female, unchangeable and determined by the genitals that a person is born with. Any dispute about one's sex would have to be clarified using genetic testing, unquote. This is completely horrifying, and it is necessary that municipalities that where majority communities stand against this kind of complete oppression of the LGBTQ community, that we stand with the community not just in words but in action and in dollars. And that's why I'm really happy that Gen Pride, the members of which are here, have led on this. And I will add one more thing, that they have a good statement that has been released yesterday about this based on a study that was made available to us. The study is titled Aging in Community, Addressing LGBTQ Inequities in Housing and Senior Services by Karen Fredrickson Golson, which is a very important study. I would urge council members to look at it. I'll just read one quote that has been included in the study, because the study is a survey of 500 individuals. The quote is, I think, captures everything that our community members are feeling, which is, I do worry about being elderly and ending up in a rest home and the staff not accepting me or my spouse or our relationship. Are we going to feel comfortable being able to kiss each other? Can we have our photos up on the wall? Will we feel safe? How will staff interact with us? Will we be treated differently or have to go back into the closet to protect ourselves? So I think that the importance and urgency of these kinds of services cannot be overstated. Thank you.
Thank you. Councilmember Gonzalez, did you want to add anything to this? Good. Well,
Colleagues have covered it well.
Okay. And I also just want to say thank you to those who are involved in our age-friendly efforts. This fits in beautifully, and I just am grateful that we're coming together around this.
The next proposal is adding $30,000 in 2019 and in 2020 and ongoing funding for services to Vietnamese seniors. This is from Councilmember Sawant.
Please.
Thank you. This budget action will allocate $30,000 from the general subfund in 2019 and 20 to the Human Services Department to contract with a nonprofit community-based organization to fund transportation and senior activities for low-income seniors. The Vietnamese Senior Association is a very active organization which serves low-income seniors in the Chinatown International District. These are community members who rely on subsidized bus passes for transportation and senior activities. And in the past years, those subsidies had been reduced from $20 per month to $20 per 3 months. The community members also lack funds for senior activities outside their neighborhood. In a green sheet in 2018, the City of Seattle restored funding for these services. This budget action would provide sufficient funds to subsidize bus passes for the Vietnamese seniors, the seniors that are served by the Vietnamese Senior Association, and accommodate senior activities in 2019, 2020, and on an ongoing basis. And the only thing I'll add is the community members themselves, the members who are the recipients of these services, they are themselves really wonderful advocates of their needs, and it has been really inspiring to work with them on this.
Please continue.
The next is related to domestic violence, an add of $150,000 in 2019 and 2020 for legal representation for domestic violence and sexual assault survivors. This is proposed by Councilmember Gonzalez.
Councilmember Gonzalez.
Not a lot to add here, other than this was cut in the spirit of, my understanding is that this was cut in the spirit of finding efficiencies at the direction of the mayor's office, as opposed to an issue related to the quality and effectiveness of the program. So I went back and got some information from the service provider aspect, and they've told me that they've been able to serve 100 survivors to obtain legal protection orders. Those are all individuals that would not have otherwise been able to access the opportunity to have legal representation to obtain a protection order in King County Superior Court. So we've heard from our friends over at the Coalition to End Gender-Based Violence, and we've also heard from our friends over at the King County Sexual Assault Resource Center, all hoping that we will be able to maintain this funding for one FTE at a nonprofit organization to continue to provide these critical services.
Thank you.
And the last is related to nutrition and food access. It's adding $35,921 in 2019 and $37,539 in 2020 for food delivery capacity. This is proposed by Councilmember Johnson.
Councilmember Johnson.
Part of the Seattle Human Services Coalition set of requests. Sorry, Councilmember Wald. And they would allow for the expansion of food delivery to individual food banks. There are 20 food banks that are part of the existing transportation collaboration. And for example, Solid Ground's current food delivery service model supports nearly 61,000 families by providing 18 million pounds of food. So I think that there's a lot of opportunities for us to think about coordination here, because demand is far outstripping the supply that we have in this service area. And for a small amount of resources, we could really up the food delivery capacity at a time when we all know there are a lot of folks struggling with food access.
Great. Thank you very much. Any comments? All right. Is that it for this one?
That is everything.
Okay. Any questions, colleagues, on this? If not, we'll move into the Office of the Employee Ombud. And thank you very much, Jeff and Alan. And Patricia and Asha, thank you for joining us. Good. Patricia, do you want to start introductions here?
That'd be great. Patricia Lee, Council Central Staff.
Asha Venkatraman, Council Central Staff.
Thank you, and welcome both of you. Okay.
So Asha and I will both be speaking on this, and I will begin by providing some background on the current options we have for employees, the establishment of the anti-harassment interdepartmental team, what the proposed ordinance provides, and then Asha will address the issues we've identified. So currently, the personnel rules define harassment as verbal or physical conduct toward an individual because of his or her protected status, such as race or religion, when such harassing conduct has the purpose or effect of unreasonably interfering with an individual's work performance or otherwise adversely affects an individual's employment opportunities. The term includes sexual harassment. The personnel rules outline how the city will respond, investigate, and determine appropriate actions to be taken when there are allegations. The employees currently can make informal inquiries about their options and legal rights to the Seattle Office of Civil Rights, the Equal Employment Opportunity Commission, the Human Rights Commission, and seek confidential assistance from the Employee Assistance Program. However, given the multiple forums in which an employee can seek assistance and the decentralization of the investigations, currently different city departments investigate the allegations. There is not citywide data on the number of allegations, the outcomes, or the responses by the city. So in a related action, not germane to the EO necessarily, but in a related action, the proposed budget does provide in the Seattle Department of Human Resources budget a city investigator who will start to coordinate the city's response to investigations, and by the end of the year, the executive will determine which staff from other city departments should be moved into that office. On the OEO, it was a major recommendation, one of the top priorities of the anti-harassment interdepartmental team. In 2018, in March of 2018, the anti-harassment interdepartmental team was established in response to widespread concerns throughout the city. Councilmember Mosquedas and her staff were involved heavily in this, as were 21 members drawn from city departments, labor unions, the mayor's office, and the ledge department. The IDT issued their report in July with 34 recommendations, ranking them as recommendations that they felt needed to be addressed immediately to mid to long term. One of their top priorities was to establish an independent, neutral ombuds function. This would provide a safe place for employees to go to seek assistance and understand what their options are. As part of the mayor's budget, there is an ordinance that would codify this new employee ombud as part of the SMC. The new office would be in the executive branch. It, however, would not be part of any existing department. The most likely places, if it were to be put in a department, would probably be either the Office of Civil Rights or the Human Resource Department. They chose not to put it in any existing department. The budget that is proposed is $564,000 in 2019, approximately $138,000 of which is for startup costs, rent, and IT and different city services, and $562,000 in 2020, again with funding for citywide costs. There will be 3 FTEs, a director at a manager 2 level, and 2 strategic advisor 1s. The director is appointed by the mayor and confirmed by the council. The mission of the OEO is to assist city employees in understanding their options and resources and investigating the city's processes and systems, navigating the city's processes and systems for reporting, investigating, and addressing workplace conduct concerns, including but not limited to harassment. It is envisioned that the OEO will function as a navigator to provide neutral and impartial information to employees about their options for addressing allegations of workplace harassment. They will maintain confidentiality to the extent permitted by law, and they will facilitate discussions to address miscommunications that may have led to the workplace conflict. The ordinance requires them to report annually to the mayor and council on any issues that have been identified, including broad systemic impacts and any changes to the personnel rules, systems, or workplace expectations that would enable the ability of employees to bring forth allegations of harassment to be facilitated. The report is due annually in March of 31, and in addition, the OEO is requested to provide input on any policy and process improvements. The OEO will not conduct investigations. It is the intent that they provide a navigator service.
Madam
There
Chair.
are no further questions.
Councilmember Johnson has a question.
Just a brief one, Patricia. As part of your background on the function of the OEO, which is just a really fun acronym to say, by the way. I know I want to add those extra E's and O's at the end there, don't you? I'm curious about the section where it outlines that the OEO is not going to be a mandatory reporting agency. Is that a legal determination, or is that a policy decision that was made about mandatory reporting?
I believe that it was at this point, they don't quite know how they're going to implement this, so I think that part of what is required as a first step is an agreement that an OEO should be established, and then they will work on defining and further refining how they will implement this function. Does that answer your question?
It does. I mean, I think it is important for us to have a place where people can get confidential support. But I also think that it is critical in those moments of confidential support to have mandatory reporting in certain instances. And so I wanted to make sure that this was a policy choice, not a legal choice. And if it's a policy choice, I hope in the setting up of this office that the powers that be will strongly consider requiring the OEO to be a mandatory report.
I think that that is part of the considerations. I know several years ago the city set up an alternative dispute resolution center. Those concerns were raised there, as were the concerns by the union that employees not compromise any rights they have under their union contract. So there are a lot of ways to put the different pieces of the puzzle together to figure out how best to move this effort forward.
Thanks.
Madam Chair. Council President Harrell.
Just some clarifying questions, Patricia. So this office, there's 3 employees in this office, 1 manager and 2 strategic advisors, so a total of 3.
Yes.
And as you said, there's no investigations, and so I thought they don't do investigative work; they do more policy recommendations. So I thought one of the issues that the recommendations were based on a concern that the investigations would be somewhat skewed, that the people investigating in a department were somehow either biased or unable to do an objective and thorough investigation, and that could result in skewed outcomes. I thought that was one of the issues. So who continues to do the investigations if this group are not doing the investigations?
There is a new city investigator position in the Seattle Department of Human Resources. It'll be addressed in the miscellaneous paper tomorrow, but the purpose or the intent there is by the end of 2018, the executive would like to figure out who in this city is currently conducting investigations, whether it makes sense to pull, and which ones of those employees to pull together into this new unit in SDHR.
So
It will be in SDHR, yes.
it would be an SDHR. So if I'm hearing you correctly, the work of next year would be that we would sort of centralize the investigations in SDHR, addressing the concern I talked about, and then this group, the OEO, would be sort of a policy recommendation group.
A policy and a place for information so that employees who don't know what their options are or employees who may be facing an allegation have a neutral place that they could go and seek information.
Thank you.
Madam Chair? Yes. If I might, I have copies of the recommendations addressing and preventing workplace harassment and discrimination, just the short memo that was provided as an outcome of the IDT's work, and just thought I'd provide that for context. I think that the summary that Patricia already provided for us is a comprehensive overview of the IDT's recommendation. I think it's important to note that the Employee Ombud, OEO, is 1 out of 35 recommendations, as she mentioned, and within that they have this bulleted list A through K, and perhaps we can spend some more time delving into some of the recommendations, but to root us in where those came from, I wanted to make sure folks had a summary of that small report that came out highlighting some of the work that they had.
Good. And just building on that, Councilmember Mosqueda, thank you. And I'd asked the question yesterday of Central Staff, if we're having a whole nother body, do we need the 2 that we already have? Do we want to continue with our Seattle Office of Civil Rights and our Department of Human Resources in terms of their investigating? What I understand, and I've received a quick note from Mariko Lockhart and Sue McNabb saying it's a different focus, that the Seattle Fair Employment Practices Ordinance and SOCR really prohibits employers, that's us, from engaging in discriminatory employment practices, and SDHR addresses employee misconduct. So this third entity is providing that space for someone who is concerned, doesn't want to file a complaint against, let's just say, his or her supervisor, feels that they need to have better information in a neutral place where they can go quietly off-site, and then that is what OEO will be doing in part, which is providing that spot for an individual to come get the information about what tools are available to them, and then get them back off in a new direction. Am I summarizing that correctly?
Councilmember Mosqueda could probably answer this better, but I will take a stab at it. My understanding is that although SOCR and SDHR are currently places that employees could go to seek advice, as well as their own HR department, some employees are reluctant as a first step to go to their own HR department or to a city department that has enforcement powers and investigatory powers, and it feels too much like you were already stepping down a path that you aren't sure you're ready to go on. So the idea was to create a neutral place that doesn't have investigatory or enforcement powers, that would simply be an educational, informational place.
So it's not, a person wouldn't go there for advocacy, for example. They don't.
Not at this point. That's not the intended first step on this. Whether they evolve into adding more functions to the OEO, I think remains to be seen.
Madam Chair.
Oh, please.
If I might, I think you're hitting the nail on the head in terms of 2 of the big policy questions we have to discuss as a council. One is the Office of the Employee Ombud, which will provide training, ensure accountability, and oversight. And this is, as Patricia said, intended to be a neutral body, a navigatory body, and to be help with navigating versus advocating, which, as you can see, was one of the recommendations from the IDT. So that's one question: is are all of the components of an ombud reflected in the policy that we see so far? Are these good first steps? Do we want to take one bite of the apple and come back later? Are there more pieces that we'd like to add? The second question, I think, is is, do we have all of the right tools for the investigative unit? Are we providing enough resources? They're going to be responsible for conducting employee misconduct investigations, creating consistency in investigations, reducing duplication or possibilities of investigations not being conducted uniformly or timely, which I think are really critical part of what we saw come forward from the RSJI analysis, and there's clearly a need for that. So I think for my purposes, I'm really trying to think about, are these two buckets adequately staffed, resourced, and are these the right roles? And that, I think that's part of the questions that the council is tasked with answering, in addition to just the daily functions, if I have that correct.
That's correct. So we've identified several ways that we thought we could, as issues or options to strengthen what has been proposed in the mayor's ordinance, and Asha is going to address those if you're ready to move to the next.
Are we? Okay. Please.
So you've already hit on several of the issues that we identified. The first is because the OEO was formed in response to the recommendations, but the office itself doesn't exist yet. We don't know how the OEO will actually comport with those specific IDT recommendations. So that it's basically that list, the A to K list that Councilmember Mosqueda was referring to. That the recommendations were that it be an advocate for employees, to be independent from the executive. So the remainder of those concerns that came up still exist. And so the options that we've identified to potentially address that is to amend the legislation to require that OEO provide council with an implementation plan that would cover all of these issues. So how they would be meeting the expectations of the IDT, if they're going to gather data on the types of employees they've assisted, do that in a confidential way, record the types of complaints that might be coming in, the number of issues that get resolved, and then what the role of the IDT itself is, and how oversight might continue. And so we had proposed that that should come in by the end of the first quarter of 2019. And then the second option B would be to just pass it as proposed. The second issue is that the legislation itself requires that OEO submit an annual report. The executive order talks about the IDT working with the anti-harassment IDT working with SDHR and OEO to submit a work plan, provide some oversight of OEO's implementation, and generally just work with SDHR to move the city's efforts forward. But none of those are reflected in the legislation itself. And so some of the options to remedy that would be option A, to amend the bill to require that the annual report is done in consultation with the IDT. Option B is to amend the legislation to allow the IDT to submit a supplemental independent report that would come in when OEO submits its annual report. And then option C would be to pass as proposed.
Okay, keep going. Okay. Oh, Councilmember Mosqueda, did you want to add to that?
I just wanted to sort of signal, I think that these are really critical questions. Part of what I'll be hoping to find out more from conversations with the mayor and our own team who participated in the IDT. I think that the initial concept was to really have the IDT and Office of the Ombud really connected at the hip. So to me, that would signal leaning towards A. Looking forward to getting more feedback from you all and from the mayor's office as well about the pros and cons of that.
Okay, great. The third issue is that it is not entirely clear how the city will strengthen its response to harassment allegations. As it stands, the legislation states that the annual report should be submitted to both the mayor's office and city council and have any issues that have broad systemic impact with recommendations on how to change city processes and systems. But the legislation doesn't require that the mayor or council take any actions based on the recommendations that come through the OEO. So the options would be A, to amend the bill to require that the mayor respond and that council intends to respond with how they plan to address the recommendations within 90 days. Option B would amend the bill to require OEO to compile and maintain data on the number of employees that they serve and the types of concerns they've been hearing and report on that in the annual report. And C would be to pass as proposed.
Very briefly, if I might, when I look at option A, it reminds me of some of the work that we did with the Domestic Workers Bill of Rights, and I think some of the conversation there was to ensure that any report backs or policy recommendations didn't have a long shelf life, and even if there wasn't an immediate policy recourse to be offered by the council or by the executive, the concept, I believe, was to make sure that we, the council, were being responsive, and if additional time was needed or if additional information was needed, that would suffice the 90-day requirements, at least related to that other piece of legislation. Is that similar to what you were thinking, just as long as there was some form of a response?
Yes, we were thinking about a similar concept.
And you're right, it comes out of the domestic workers.
Patricia, did you say something that we needed to hear?
Oh, I'm sorry. Yes, Councilmember Mosqueda is correct. It comes out of the domestic workers ordinance.
Okay.
The idea.
Okay. The fourth issue is that it's not entirely...
Most important issue here is why does it only cover the executive department?
So the legislation says that OEO is available to assist city employees, but the executive order was clear that it applied to executive departments, as is appropriate for an executive order, but it might be helpful to make clear that the OEO is available to all city employees, so in all branches of government. So the option for A would be to amend the bill to clarify that it would in fact assist all city employees, not just the executive, and then B would be to pass as proposed.
I would totally support that. And I'm also looking at what the University of Washington has done as a single, I mean, essentially it's a single portal, so that staff resources, faculty resources, the student resources are available on one site, and then it also leads into what are the strategies to engage in informal problem solving. So I would hope that we would do something similar here, so that whether it's restorative justice model or what we can do, but put us on a track that's looking at some alternatives to lawsuits.
Absolutely. Okay. The fifth issue deals with something you've also mentioned. The proposed budget includes 3 FTEs, the manager 2 position as the Ombud, and then the 2 strategic advisors. But it's not entirely clear that whether that would be sufficient for the office. And the other issue is that this does not include any administrative staff. SDHR and OEO plan to enter into a memorandum of agreement for SDHR to provide that admin assistance. And so the options to deal with this would be to amend the bill to require that OEO assess its staffing in its annual report, so we have some idea of whether this would be an appropriate level of staffing, or the second option, B, would be to pass as proposed.
And I think we looked at the budget and I didn't see that they had included just basic administrative costs like location, what building it would be in or how much that would cost and annually. So is there a plan for that currently?
So they have included
co-locate?
citywide allocation costs and some costs to FAS, but we're currently finding out what that actually covers, because I don't believe that they know where the office is going to be yet, so that might not include the space rental type of costs.
I think it's important that we find that neutral site for this, that it's not co-located with Department of Human Resources. I think that it's, if we're really trying to give people a neutral place, that one where they feel comfortable going, I'd like us to explore that.
Okay.
Councilmember Gonzalez?
Took the words right out of my mouth. I think the budget clearly only provides funding for actual personnel, but doesn't take into account that this would be an entirely new office with unique privacy concerns related to people who may be seeking to engage with this particular office. And so I think we have to be very cognizant of the realities around the capital and operational costs that are that are not currently included in the mayor's proposed budget, as far as I can tell.
And we'll follow up to confirm.
Thank you.
Madam Chair.
Councilmember Mosqueda.
I apologize if this question's already been asked before and you've already answered it. Is there any way for us to assume cost savings if we are consolidating HR or investigative roles, or even reducing the number of individual outside consultants or counsel that are being brought in by various departments? Is there any cost savings that we can assume?
I think that kind of speaks more to the investigation piece that's going to be in SDHR. And until we get the report at the end of 2018 as to which staff that they're planning to move or if they're consolidating any of the investigation functions, it's going to be a hard question to answer.
Council President Harrell.
So this is where I'm just trying to get some clarification, and that is the OEO, they're charged with the policy recommendations of harassment issues, but does it include either racial harassment or race discrimination still? It still includes discrimination, correct? As I'm looking at, because I thought the July 18th report said addressing the prevention of workplace harassment and discrimination. So
Yes, it will address both of those issues. Technically, I guess harassment is a form of discrimination, or legally, I guess.
So one of my concerns, I support where we're trying to go with this, and when I first had read about the OEO, it looked like a very smart way to address the root problem. What concerns me is when we look at the overlap, that if an aggrieved person, if they still have the option to go to the Office of Civil Rights to have an investigation done, or, and I understand this OEO is more of a policy side of things, but I just hope there's not confusion down the road. I guess that's where I'm turning, because right now we turn to SOCR for a lot of policy recommendations as well, and they still, I think they have a policy function in addition to just being investigators. And in theory, they come up with recommendations, and as does some of the commissions, and we as the policy leaders take all that into consideration. So as we sort of create this office, I still wonder if there's going to be some overlap and some confusion.
I think that's understandable, and OCR is part of the IDT. It feels like there's a lot of acronyms. The Office of Civil Rights is part of the interdepartmental team. So having them work with the Office of Employee Ombud in the development of those recommendations will hopefully provide some of that consistency.
Okay. You all right? All right, please continue. We still have one more department to get through before we close.
The sixth and the last issue is that one of the IDT recommendations specifically was that the OEO be independent from the executive. The bill states that the Ombud will be independent from other executive departments, but not independent from the executive branch altogether. And the Ombud will be appointed by the mayor and confirmed by council, and is very likely subject to at-will removal, which is similar to the way other directors in executive departments are appointed. But given that, this brings up some issues just around what independence means practically. There are a few things that could ameliorate this concern. First, that the Ombud is, in fact, separate from all of the departments, particularly the Office for Civil Rights and the Department of Human Resources, which I think are the two big ones in terms of when people have concerns about independence. The navigator role is intended to recommend changes to the existing system as they work within it. So looking at revising the current system is already within its sort of scope of work. Oversight by council can provide additional safeguards. If you all decide to amend the ordinance to require submission of an implementation plan, that will be an opportunity to look at what independence might look like. Similarly, if council amends the ordinance to require the annual report to look at the number of employees and the type of concerns they have, there will be some indication as to whether employees are actually using the Office of the Ombud and whether there is an environment of trust that office has fostered. And lastly, the appointment structure itself is commonly the one that is used across executive departments. The only other real mechanisms for appointment are for things like the Ethics and Elections Commission. Their director is appointed by the commission itself and then confirmed by council, or the city librarian, who is appointed by the library board. So the options for this piece in particular are to amend the bill to provide either a different appointment structure or change the Ombud position to a term position with a term limit and removal for just cause, or pass as proposed.
Anybody have any thoughts on that at this point?
I just, I think this is an important thing to consider, and I'm interested in exploring also, how the auditor works as an independent as an example too. I think once we establish it, and the department is accountable to the mayor, but independent of the mayor, but in theory is going to evolve over time. I just question whether that person will feel empowered to say, I think we should switch it so I can no longer be fired by the mayor. That's going to be a hard thing to say. And so, we can do those things midstream, but they're harder. And as we think through this, I don't know the timing on this, how much we need to resolve in the budget, or if there's maybe some space to create some time some time after the budget to think through this and just be really thoughtful on it up front.
Councilmember Mosqueda.
Thank you, Madam Chair. And Councilmember O'Brien, your points are really well taken. Part of our initial questions were what the timing is of needing to pass legislation that corresponds with the budget. We're used to thinking about bills that are necessary to implement the budget. Can we pass this, allocate funds, deal with the policy questions as a trailer bill? One of the dates that we were looking at to hold a potential hearing with the council president's approval would be in early November, just so that we could get some of these policy questions asked. But if that timing is not usual, look forward to working with you all to make sure that it's workable.
That's great. I've never worked in an environment quite like this, but I think it would be really important. I think it'd be really important to hear from employees. And I'm thinking it may also be worthwhile setting up a way to hear from employees anonymously if folks also feel that same kind of fear of retaliation or something by speaking out. And so, and I think we're not going to have capacity to deal with that thoroughly between now and some serious decisions we'll be making in the next few weeks. So I imagine we can probably do whatever we want and create as much space as we need to make this happen. And so I don't want to delay it because I think it's important, but let's just be thoughtful on how much time we need.
Councilmember Herbold.
Thank you. I just want to thank Central staff for the work that they've been doing on this. We have a 7-page document that outlines a lot of the issues that they've been working hard to think about what the options are. As it relates specifically to the issue of independence, I just want to underscore that the anti-harassment IDT really emphasize the need for an independent ombuds office. We can, through the legislation, define what independence means, and obviously we want to make sure that that's consistent with both the IDT and also works for the needs of our workforce. And I think there are a lot of other issues that Central staff has done a really good job around flagging for review of this budget legislation to address, including the scope of the new entity and reporting requirements. There are some outstanding questions, but I would like to see if we could work towards addressing them within the context of the budget. We won't be actually voting on budget legislation until, it's typically the last day of budget. So if we could keep working towards answering those questions within the context of the budget, using the issues that have been identified and the options that I think we've indicated an interest in, I think that would be a great thing to strive towards.
Council President.
Councilor, just a question for clarification. The need for an independent ombud that seems to resonate in all the conversations, it's very clear that it's a need for an independent policy advisor, not the investigation, because when I read about that, I assumed that it was always the investigative part, the fear of retaliation that people were concerned about, not so much where the policy recommendations came from.
It's, as Patricia, Central Staff member Ms. Lee indicated, that it's the place that you go to before you file a complaint. And so employees want to, before they dive in with both feet and in filing a complaint that will be investigated, not by the OEO, but it gives them a place to go where they can understand more about what the expectations would be and what the steps are following a complaint if they do file file one. And I think there's a great need for independence and confidentiality around addressing those needs.
So I didn't hear that charge in the OEO. Was that described thoroughly in the, because I was reading what we were talking about the OEO and I didn't hear that piece of it.
That's essentially their navigation function, is to outline to employees what their options are, what that looks like, all the different venues at which they could raise a claim.
See, okay, so that's good clarification for me because I assumed it was more of a stand. I didn't assume they would have as much direct contact with the aggrieved employee as we're saying now. I saw it more as a policy body, but not almost. I mean, they're almost an advocacy role to some extent. Well, it's the navigation role, I guess. Okay, so that helps me.
And they provide navigation both for people alleging that they had been the subject of discrimination or harassment and persons that have been accused of the same.
Thank you.
May I provide an anecdote? Just anecdotally, we hear a lot about people who maybe experienced an uncomfortable situation, maybe not rising to the level of harassment or assault as the legal definition. And we know that a lot of people don't come forward right now because they're worried that that might mean that their boss or their coworker might get fired, or they think that maybe if they report it, then it'll get back to someone, and it limits their ability or willingness to come forward because they don't know what their options are, or if there is a range of the options to correct the behavior. I think what we need to discuss is when we think about an ombud and the role of a navigation team being independent and providing people with options, I think it might make it more possible for people to see themselves coming forward just to explore whether or not this is something that could result in potential corrective action. Doesn't have to mean somebody gets fired, but what types of corrective action might there be? Who might they want to talk to? Perhaps there's counseling involved, and it's possible that someone would be more likely to come forward in that scenario, which is very much in person and requires a lot of new trust building. And so I think that's the importance of having it as an independent entity. We are hoping that they build that relationship and help people navigate a system that right now offers, recourse only if it meets a certain legal standard. And I think we're trying to look at the continuum and the spectrum of need.
I think we're good.
Thank you.
Anything else on that? Any further comments?
There was
All
just
right.
one
Council
council
President.
member proposal, which Councilmember Herbold already spoke to, which is to amend the legislation just to ensure that we know what independent structure, oversight, all of that means.
Okay, very good. Thank you for your continued work on that. We just got a thumbs up from our council president, so we'll move on to the Office for Civil Rights.
All right. So this is still me, Asha Venkatraman, Council Central staff. So I'll be talking about the Office for Civil Rights, or OCR. I'll start just by describing the office itself and then get into the one identified issue, which is that workload growth is exceeding staff capacity. So the mission of the Office for Civil Rights is to end structural racism and discrimination through accountable community relationships and anti-racism organizing, policy development, and civil rights enforcement. The office has 28 full-time employees in 4 divisions: administration, policy, enforcement, and the Race and Social Justice Initiative. Because of the work they do in equity, they're in a position to influence the pace and degree at which the city realizes getting to racial equity, and that is a root cause of many issues that we see. In this year's budget, in 2019, the budget is about $4.7 million, 8.2% less than in 2018. It's about $415,000. It's a net reduction. Most of the reduction came from baseline and technical changes, in addition to a $30,000 operational efficiency reduction. But the mayor's proposed budget adds back in funding for the extension of a temporary equitable funding position for 6 months. It reclassifies some RSJI positions, and it adds in a deputy director position. So as I mentioned, the issue here is that workload has exceeded staff capacity. And what I'll do is describe some of the reasons for that and go through the issues for the policy enforcement and RSJI divisions. So there are multiple reasons why workload growth has increased lately. One is the passage of new legislation. There have been multiple requests for OCR to lead or participate in interdepartmental teams or work groups. Multiple asks for responses on the basis of executive orders, statements of legislative intent, resolutions, adds to the budget in which OCR is acting as a pass-through, so they need to administer and distribute funds. Requests for racial equity training and assistance, the homelessness emergency and the housing shortage. They lead citywide initiatives, providing advice on culture change, broader systems like criminal justice, and provide technical and training assistance. All of this additional work has resulted in delays in policy work getting done, in case backlogs in the enforcement division, and reduced RSGI's ability to fulfill requests for assistance. So in the policy division, they create legislation and other policy recommendations, and they also provide policy support for the 4 Office for Civil Rights Commissions, which are the Human Rights Commission, the Women's Commission, the LGBTQ Commission, and the Commission for People with Disabilities. So recently, the executive or council have requested their leadership and participation, sometimes in conjunction with added staffing and resources, sometimes not. At the bottom of page 2 of this memo, you'll see there's a list of projects that since 2015 that OCR's policy division has been asked to lead or staff. And these are asked for substantial amounts of assistance. It's things like the Gender Justice Project, Zero Youth Detention, Reentry, the Anti-Harassment IDT, things like that. Additionally, they've been asked to help with, since 2015, things like the Racial Equity Toolkit on the Hookah Lounge, the City Attorney Office's pre-filing diversion program, the Community Safety Investment Work Group in the Human Services Department, and King County's Familiar Faces Initiative. On page 3, you'll see a list of the legislation that's been passed since 2015 that the policy department has either developed or assisted council in developing. There's about 8 bills listed there. So that's additional, not additional, but that's more of the work that the policy division does. There are 5 people in the policy division, 3 of whom do the bulk of this policy work. They're devoting the bulk of their time to both these initiatives that have come up, as well as requests from council to do additional criminal justice work. The way the policy division in OCR works is to be, the principles that drive them are being accountable to the communities that are most impacted by their policies and driving policies through community-led solutions. This is a little different, I think, than traditional policy work and how that happens, and so it takes some more time and resources because it involves maintaining communication and relationships with community members, with organizing and impacted communities. They attend community meetings and events and strategy sessions. They often convene work groups when they're asked to develop policy to formalize accountability, and they compensate community members at outreach events with things like food and childcare. Notably, there's no dedicated funding or staffing in the Office for Civil Rights for outreach. This is all work that the policy team does. They also absorb work that has emergent work that comes up, like the encampment monitoring and reporting work that happened in 2016 and 2017, as well as the anti-harassment IDT. They also do policy work for each of the commissions, and so there can be substantial work that comes up that can take priority over existing workload. Because of limited staffing, this division has had to delay work or has been unable to assist other departments in doing some of their work. For example, the action plan to get to zero youth detention and develop that out regionally has been slowed down because of strained capacity. There's been a delay in the development and delivery of workplace sexism training, as well as engagement with the community around the connection between gender justice and the criminal legal system. The Office of Housing is doing its community preferences work and would like OCR's assistance, which has been difficult to provide, as well as full support of the Equitable Development Initiative moving forward. So that's the policy department. If there are no questions on that piece, I'll move into enforcement. So as you might imagine, this division enforces both federal and local laws under OCR's jurisdiction. They conduct civil rights testing. They do intakes for complaints. They investigate complaints, see the enforcement process all the way through the end of those complaints, and they also provide training and technical assistance.
Asha, may I just take some liberty here. I'm assuming a lot of the colleagues, because they're also immersed in OCR, that what they're doing now, I think maybe we could skip past that and go to the options. Are people comfortable with that if we do that? I think we know the enforcement and the RSGI piece. Is that acceptable to?
I think it's acceptable, but I don't want to lose sight of, I think, the important point that Asha is making as it relates to, not just to that the work is important, but that there are some workload challenges. One of the things that...
That's why I waited for her to finish that part. But even on the enforcement side? I thought I heard her. I was the areas where they just need a lot of help and they've delayed. I got that, so I was...
Okay, I heard you reference the good work they do. I just wanted to make sure that not only are we hearing the good work that they do, but that they're understaffed to do that good work.
I can move real quick through enforcement and RSGI. Just
that'd be good.
Very briefly. So the issue with enforcement is that they have a backlog of cases. So that's been starting since 2015, but it's increased substantially lately because of the addition of all the new legislation that's been passed. They've consistently had about 5 investigators since 2015, about 5 to 6. But given when they do testing, there are spikes in intakes and complaints. And so the average amount per investigator is higher than it should be. It should average about 25, but they're this year up to 33, and anything over 30 tends to reduce efficiency.
And I also want to make another point here as it relates to their enforcement model as compared to Office of Labor Standards. We had asked for a comparison of the number of laws that SOCR enforces as compared to the number of laws that Office of Labor Standard enforces, just because they're similar regulatory bodies, and the fact that SOCR has a minimum sort of case level or a maximum case level that they want their investigators to have. OLS has a completely different approach for what is considered an acceptable case level. SOCR has significantly fewer cases as a backlog than Office of Labor Standards does as well. So I think it is, even though it's not identified as an option, perhaps I should have flagged it as an option. I think looking at the structure that SOCR uses to determine the caseload that its investigators had should be taken a look at for its efficiency and effectiveness. I just, again, there's a different approach. OLS has a much larger quote unquote backlog. They don't take all their cases, whereas SOCR does take all their cases. So they also have a different approach, not just to how they investigate, but making decisions about which cases to investigate.
Yeah, and there are a couple reasons for the difference in approach. One is that OLS does a lot of directed investigations in which they do company-wide investigations, but they don't need to have a complaint come in for that. The way that OCR's, the laws that they enforce are structured is that they have to have some sort of suspicion that something is happening. So they can't just go out and decide that based on one complaint, they're going to investigate an entire company. Instead, they have to do testing, or they have to look at ads on Craigslist to figure out what's happening there. So that's one piece of it. And then the other piece of it is that the way OLS functions, they have a community engagement and a business outreach specialist. And the reason for that is because OLS can refer their cases to places like the Fair Work Center. So they don't have to take all their cases, but OCR is the place where everybody else refers people to take their cases. So even if somebody goes to the EOC or the Washington Human Rights Commission or talks to nonprofits, OCR is the place where everyone refers their cases. So they take on, they're the place that gets referred to, as opposed to referring to other places. The last piece is RSJI. As you all know, RSJI is the citywide initiative. And just real quickly, it's 7 FTEs, a manager and a supervisor, and 5 liaisons. And they're basically providing all of the RSJI support for the entire city. So that's almost 30 departments. Each of the executive departments have to do 4 racial equity toolkits per year. So that's about 120 toolkits per year that 5 people are staffing. Departments submit requests, 8 to 10 additional requests per month. They get external requests, 7 to 10 of those per month. And they also also are doing hundreds of hours worth of training every month. They're asked to do very resource-intensive RETs. They did the ones on the hookah lounges, what happened at 23rd and Jackson, workforce equity, community service officers. The asks on them are straining capacity to the point where it's slowing the progress of racial equity in departments. Departments can end up contracting externally with people that don't have the same sort of racial equity lens. It's delayed creating a shared language and understanding across the city. Every time there's new leadership, there needs to be more, or there needs to be baseline understanding of racial equity. And it's also delayed them from being able to do several projects moving forward. So I guess across the board, there are some capacity issues. And so essentially the options that I've identified are I think minimal staffing to supplement the staffing they currently have. Could be one FTE civil rights engagement and community outreach specialist. This would help the work that the policy staff is currently doing around community outreach. An additional enforcement investigator, one or more policy advisors for criminal justice and gender equity work, and one or more RSJI staff, and then ongoing funding for community engagement and capacity building. If no one has any comments on those, I will move into council member proposals for OCR. The first is the Indigenous Peoples Day celebration. It would add $25,000 in 2019 and in 2020 for ongoing funding support, and this was Councilmember Sawant. Since she is not here, I'll just provide a little more detail. We normally fund, the council normally funds, provides some funding for the Indigenous Peoples Day celebration, but the staff is usually out asking departments and getting little bits of money from multiple departments year long for this. And so creating this would provide funding in an ongoing way. The second is—
A little highlight on that. When she says we, she literally means we are out there asking other departments to give up some of their budgets to have this great celebration. And maybe there's a more sustainable way to do that, but so far it's been working, and departments have been little arm twisting, but they've been stepping up. So, and I want to thank you particularly, Asha, as well for your work there.
The second proposal is a workplace harassment investigation statement of legislative intent. This is also Councilmember Sawant. This would request OCR to report to council about changes to the code that would be needed to more effectively investigate complaints. It's both for when the city is an employer as well as when the city is investigating external employers in the city, or in the city of Seattle. And that would be due back to the Civil Rights Committee by April 1st, 2019. The third proposal is to make permanent the equitable funding position in OCR. It would be adding one FTE, about $61,000 in 2019, since the mayor's office has already provided half a year's worth of funding, and almost $139,000 in 2020. This is Councilmember Herbold.
Councilor Herbold, would you like to speak to that?
I think that is sufficient. I think it addresses some of the capacity issues that that have been identified. Certainly not all of them, but it continues an important role that the SOCR is currently playing in coordinating the city's violence prevention and youth detention investments.
And Councilman Herbold is the policy lead for this department. On the options that were earlier identified, the different FTE positions, 1, 2, 3, 4, on page 5. At some point, I just would love to hear your opinion on that and where you're heading with that. So
Sure.
You don't have to do it now if you're not ready, but at some point.
Absolutely. This particular position is an existing position, I want to clarify. That was not included, funding was not included in the mayor's proposed budget.
Very good. Go ahead.
Okay. The last proposal is for zero youth detention funding. So to add $400,000 in 2019 to continue youth violence prevention and diversion work. It's Councilmember Herbold.
Councilman Herbold?
Thank you. In 2015, under Councilmember O'Brien's leadership, the council adopted Resolution 31614, calling for the city to adopt a vision for zero use of youth detention. In the budget process in 2016, the council allocated $600,000 to SOCR to contract with organizations creating community-led strategies for alternatives to youth detention with a focus on upstream approaches. Those funds were distributed using the Social Justice Fund's Giving Project model. That model brings together a multiracial group of 15 to 25 people who then work together over several months to build community and develop a shared analysis of race and class, fundraise from their own networks, and make strategic grants. For that particular funding cycle, the participants worked together. They developed their key objectives and strategies and made recommendations for investments given the available funding. After helping to develop the funding model and overseeing the first round of funding, the Social Justice Fund was no longer able to administer the funds. And in 2017, the Office of Civil Rights took over the organizing and administration of the Zero Youth Detention and Consortium funds. In 2017, for the 2018 budget, a proviso was placed on $100,000 of the funds to be spent on this youth diversion program until a spending plan was submitted and approved by the council. They attended my committee and presented that spending plan and received approval for it. And this budget action would provide $400,000 to fund a community-based organization, such as Community Passageway, to work with 45 youth by supporting 3 full-time and 2 part-time staff positions. It's intended to be part of the Budget for Justice package, which includes proposed investment recommendations, a number of them.
Very good. Thanks for that explanation. Did you want to add anything, Councilman O'Brien?
Yeah, I just want to take a second to lift up the great work that the Office of Civil Rights does. And we have clearly been, because of their great work and their great training of all of us, we have been directing more and more work towards them. And I think we're going to have to figure out through this how to make sure they're properly resourced, because this is central to, frankly, all the policy work we do with the city. And Councilmember Herbold, I appreciate both these last two. That equitable funding position I know is a key position, not just internally, but I know community members really think that it's important to retain that position, to figure out how we fund ongoing work in the community. So I'm excited about that one. And of course, the zero youth detention work is it's near to my heart. Thank you.
Very good. So I think we're going to thank you, Asha, very much for that great presentation. Expected nothing less. And we will adjourn and reconvene at 5 o'clock, where we will listen to public testimony and a public hearing. I'm sorry?
Is it 5:30 or
Is it 5:30 or is it 5 o'clock? What time? 5:30. I stand corrected. 5:30. We'll see everyone at... Oh, we have public comment, and I will chair the public comment. My bad. Okay, we got public comment right now. And you come back for another bite of the apple at 5:30 too. 2 minutes. 2 minutes. How do you know I don't have brain damage? Alex Zimmerman, you're up. And then the Honorable Michael Fuller will be second. You got it. You got it.
Show my face.
We gotta go.
Goebbels, show my face.
4:15?
Goebbels,
What time we're
show my face. Goebbels, show my face.
Okay,
Goebbels, show my face. You see, Consul Harrell, you attorney, this crook, show my face. Goebbels, show my face. Goebbels, show my face. Goebbels, show my face. You see, this Nazi pig don't want to show my face. So how is this time? Time not supposed to be clicking. You see, nobody see my face. So why is time clocking right now? Nobody see my face. Show my face. Goebbels, show my face. Goebbels.
I know. I have to. She's pulling me. I was trying to.
Hi, my dirty Nazi pig. I want to speak about Human Rights Commission. For 1.5 years, this crook don't make investigation of my trespass. What has happened last year when I go candidate for city mayor? A pure fabrication. This Nazi pig for 1.5 years don't make investigation. This Nazi Gestapo pig for 1.5 years don't make my complaint about my trespass. This Nazi Gestapo pig for 1.5 years don't make my investigation? Why you give money to these crooks? And you, Harbord, responsible for this. And for 1 month, I want to meet with your staff. Nothing happened. For 1.5 years, Seattle Human Rights Commission don't investigate my trespass because it's pure fabrication. Pure fabrication. For 1.5 years, this Nazi Gestapo pig not investigate this. We need to clean this dirty chamber from this bandita, from this Nazi, from this Gestapo. Stand up, Seattle. Stand up, America. Clean this dirty chamber from this Nazi Gestapo pig.
Honorable Mr. Fuller. Mr. Fuller, you're next. Please go ahead and start his time.
Yes, as I continue in prayer, I'm here because I'm looking at the extraordinary abuse of you nine Neanderthals in violation of First Amendment right, due process, equal protection of 14th Amendment rights, and procedure due process and substantive due process against Margaret Lloyd Richards. Now, Margaret Lloyd Richards is your employer, and you are the employee. Now, this must go on the November 6th ballot and the budget. How can you abuse your authority and power over we the people? Extraordinary pimping we the people. You know, wait. Now, that's called a conflict. And when it's a conflict, the state constitution is that the state must yield. The federal constitution is that the United States versus First Bank, September 27, 1983, and Bivens versus 6 unknown agents, 1971. President Bruce Harrell. See, I told Bruce Harrell, I'm going to hold you accountable. And I want you nine bigots to know, I'm not new to this, I'm true to this, and I'm very articulate. Ron Johnson, you discriminated against Margaret Lloyd Richards. I don't like that. That violates 98.36080, malicious harassment, and 42.52020, meaning activities incompatible with public duty, and 49.60030, freedom from discrimination, and American with Disability Act, July 26 of 1990, and Section 504 of the Rehabilitation Act of 1973, and Title 6 of the Civil Rights Act of 1964.
Thank you. Thank you, Honorable. Thank you, Honorable Fuller. Your time is up, sir. Thank you.
I'm not.
Thank you. So, sometimes we wake up and wonder, how did we get here? Let's move on to 5 additional folks that have signed up to give public testimony, and thank you for your patience. We're going to start with Phoebe Feldscher and then Hillary Coleman. Hillary, you're going to be followed by Maureen Linehan. I might have been quoting Talking Heads. Thanks for your patience, Phoebe. I just looked up one day, and then all of a sudden I was in charge.
Hi, my name is Phoebe Felcher. I'm a housing case manager with Plymouth Housing Group. Of the 1,000 people or so that Plymouth serves, 110 live in the building that I work at, and 45 are on my caseload. Many folks that are housed by Plymouth come directly to housing from chronic homelessness and have extensive trauma histories on top of significant mental or physical health issues. In November, I'll celebrate 1 year at Plymouth, and already I'm the most senior housing case manager in my building. Tenants joked with me when I first arrived by asking if I was here to stay or if they had managed to scare me off yet. The folks that I work with continue to make similar jokes, and they're trying to prepare themselves for what feels like an inevitability. Whenever direct services staff move on, the entire building grieves. It's inevitable in work that demands powerful connection. Many tenants have experienced significant trauma or abandonment, and we are asking a lot of folks when we ask them to trust us. Frequent staff turnover reinforces the narrative that folks aren't worth sticking around for, that they push people away, and that eventually everyone does leave. Often folks walk away from these positions with heavy hearts, their own survival compelling them towards other agencies or areas. Social services wages have not kept pace with cost of living adjustments, and folks are struggling. I personally have experienced housing instability while working full-time. It's deeply ironic to me that the very people trying to help folks stay housed can become at risk of homelessness themselves. You've heard that people don't come to this work for the money, and that's absolutely right. They come for the opportunity to do something truly revolutionary, build community by fostering connection, healing, and hope. I'm so grateful to have the privilege of doing that. And while I know this council recognizes that building relationship is essential in keeping people housed, I urge you to consider the stability of service workers, of those folks whose work so many admire and appreciate, by compensating them adequately so that they don't have to make an impossible choice between their own survival and their community. Thank you.
Very well said, Phoebe. Thank you. Hillary, you're next. Maureen, if you wouldn't mind coming to the other available microphone, that would be great. And Maureen's going to be followed by David Held.
Hi, council members. Thank you for all your time today. I am here with the Seattle-King County Coalition on Homelessness, Hillary Coleman, and I am asking that you specifically support Councilmember Mosqueda and Councilmember O'Brien's proposals around workforce stabilization and looking at closing the wage gap. Specifically, we want to make sure that Councilmember Mosqueda's proposal for $5.9 million for 2019 to go beyond what the mayor has proposed in her budget is implemented. This is important, as was mentioned, because we want to make sure that we are going beyond the 2%, which is not enough, to start to go for enough. And we also want to make sure that we are doing this for all of the different contracts in the city, not just the ones funded through the general fund. As Councilmember Mosqueda mentioned, it's important that those that are getting funding from other sources are also getting this, and especially our frontline staff that are not funded through the general fund sometimes. So we want to make sure that we are mentioning that. And we also, of course, want to have the wage gap study so that we can really look at starting to close the wage gap and making sure that we are providing good services and that our organizations and staff are continuing to be able to provide those. I have a couple more of our postcard messages for you all about from staff specifically about these. This is someone that works at Plymouth and says, I work in low-income housing and I directly experience the life-changing impact of housing, as well as see the impact that low pay has on the wonderful people that do incredible work. Another provider in our community writes that housing is a human right and it works. In order to support people to overcome barriers and move into housing, we need to pay a living wage to workers in homeless and community services. And finally, another provider writes that I work with homeless folks who deserve a roof over their head and a chance at stability. Also, we need more pay to sustain our work. So thank you very much, and thanks in advance for hearing everyone's comments tonight as well.
Thank you, Hillary. Maureen, thank you for your patience.
Sure, thank you.
Through today. You're going to be followed by David. David, if you wouldn't mind coming to the center microphone, that'd be great.
Hi, good afternoon. I'm Maureen Linehan. I'm a board member of Generations Aging with Pride. And I just want to thank Councilmember Herbold and Councilmember Sawant and Councilmember Gonzalez for bringing forward the funding potential add of $249,000 to help provide supportive services for older LGBT individuals throughout Seattle. I have a 30-year career in aging, and including working for the city's aging division for 18 years, and I retired a year and a half ago, and this is what I'm devoting my time to in my retirement. So that's how critical of an issue this is for me and for other people of the LGBT community. The social isolation, which your comments earlier really captured, are in part due to our peer group is our support group. We don't typically have families, and when you get into caregiving situations, we have to rely on our peer group. So if we outlive our peer group, then that really contributes to social isolation. And also we have high health disparities, which in part is due to discrimination and trauma. So you'll hear more tonight in the public hearing. I couldn't attend the public hearing, so that's why I wanted to come here today. But again, just thank you so much, Councilmember Herbold. This is a critical issue, and I look forward to your support, and thank you for the discussion earlier today. Thank you.
Thank you, Maureen. David, you're the second to last speaker. You're going to be followed by Willow Malone. Willow, if you wouldn't mind coming to this microphone. Thank you. David.
Pardon me. My name is David Heldy. I'm a housing assistance case manager at DESC. I am on a team of 15 case managers. We all work at the main shelter just right down the block. The case managers that I work with are just grossly underpaid for the job that we do. We are all fighting for the low-income housing that we're also trying to get our clients into. We live with the people that we work with or with our clients. Before I became a case manager, I worked at the shelter and was paid even less, and it's an even more difficult job than this. I've had clients die in my arms. It's an incredibly stressful job. It's an incredibly difficult job, and you need far more training and education and everything than the money that we are paid for. The first day that I was hired, or the first day that I was there, I was told, be careful who you kick out, because that person very well might just die on the streets tonight. And it's true. I know people that have died after they were barred. And these decisions are not minimum wage decisions. These are life and death decisions that are made every single hour of every single day. And the people that make these decisions deserve more. The people that we're making the decisions for deserve a more informed employee.
Thank you, David. Thank you for the gravity of those statements. Willow.
Hello, my name is Willow Maloney, and along with Councilmember Mike O'Brien and Teresa Mosqueda, I believe that our emotional labor deserves more fair compensation than what we currently receive. I also work for DESC at the front desk of the Morrison Residential Building in Pioneer Square. And in order to pay my bills in Seattle, like most of my coworkers, I work over 100 hours per pay period along with a second job where I make more in tips than I do at a full shift at the Morrison. And additionally, after just a year and a half at my current position, I'm one of the longest standing staff in a fully client-facing position. Both in supportive housing and at the shelter, I've seen the difference that can be made by patient, compassionate, and consistent staff. And I believe that if Seattle cares about helping its most vulnerable residents, we will come together as a community to invest in making sure that they have access to the highest possible quality of services. And those can only be provided if staff across all city contracts, those patient, compassionate people, can afford to stick around and do the work and also maintain their own quality of life. Thanks for hearing us out.
Thank you, Willow. And thank you to you all for sticking around with us and for the good work that you do. That concludes the individuals who've signed up for public comment for this morning's session. We'll reopen public comment in 53 minutes for our 5:30 session, which I anticipate will go long into the night tonight. At that point, Councilmember Bagshaw will be resuming her chairwomanship of this committee. But unless there's anything else now for the good of the order, we'll stand adjourned and back again at 5:30. Thanks.